Function with Purpose podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Episode 5 of Season 4, the Function with Purpose podcast. Dr. Amy here with you guys on this lovely day. Thanks for listening. Pretty much halfway through Season 4. Gonna get right to it. So, clearly we're still in a pandemic, so that means there's some time to do things, especially if you're married. I'm not an expert in this field, but I do have some colleagues, and a particular colleague, Dr. Kristen. She is a pelvic floor specialist, and so she works a lot with individuals who are going through their pregnancy, even pre-pregnancy, during the pregnancy, and even after. So shout out to Kristen. I will link her information, her Instagram profile in the comments, but today's topic: physical therapy should be non-negotiable when a woman is pregnant. The actual rehabilitation processes during pregnancy is super important, and it blows my mind that the OBGYN or medical physician does not even think about sending their patient who is pregnant to a physical therapist before, during, and even after the pregnancy happens. So literally, you're prepping the body to be fit, to be strong for actually birthing the baby, right? Especially if it is a vaginal delivery. Right? So a lot of stuff that you Google on the internet, working out during pregnancy, is it good? Is it bad? I don't know. You might lose the baby. There are so many factors that play an account before, during, and even after the pregnancy processes that I'm sure if I talk to Dr. Kristen, that she agrees with me. So physical therapy services, rehabilitation throughout the pregnancy process should be non-negotiable. It should not even be questioned that it should not happen. It needs to happen, right? Whether you are prepping for a vaginal delivery or even a possible C-section, you might even know halfway through or the start of the third trimester that you are one of those individuals that might have to undergo a C-section. And it's super important that you go see a pelvic floor specialist who understands the actual anatomy and the processes of bearing a child. Now, I can't vouch for that. I don't have any children. I'm not a pelvic floor specialist. I do treat externally, pretty much through dry needling onto the sacrum or the booty area, but seeing a pelvic floor therapist, they can do a very insightful, literally, no pun intended, internal exam to determine some pelvic floor capabilities and incapabilities. Are the muscles strong or are they weak? So then when a woman is pregnant, throughout their pregnancy, the big question is, should they be working out? And another big question is, should they do CrossFit or weightlifting? Or should they just walk? Because that's more, quote unquote, safe. So just a little bit of intel. Now, I know that there's not a lot of research out on straining indirectly to the baby as you're exercising, but the recommendation is, as far as intensity output during different stages of the pregnancy, as a woman, we kind of want to stay between the 70 and 80% strain levels. So that might come in turn of effort for the day. That might come in turn of heart rate levels, as if you track that through a wearable device like an Apple iWatch or a Whoop band. Not sponsored, totally should be. But the intensity output during exercise or even CrossFit class or running or other sporting events, we don't want to exceed that 80% threshold, because there's not enough research that expands upon that right now at this time, especially when there could be obviously a little bit more strain involved if you go above 80% effort in correlation to the growing baby. So just be mindful as you're training and working out. So a good example, some key things that I listened to in some other podcasts regarding pregnancy and working out during that time period. Now, as you guys know, that my clinic is located within our CrossFit gym, CrossFit Pineville. So, we do a lot of work with kettlebells, dumbbells, barbell, especially during CrossFit classes, and a lot of ab work. A good example of that is toes to bar. So that's where you're hanging on a pull-up bar and you're trying to kip or kind of push into this swing motion forward and then driving your legs up to meet your toes to the bar. So during pregnancy, those are some things that we need to consider, because we don't want to really strain the abdominal wall as much as the baby's growing into the different trimesters. Or if someone does continue to do kind of like this toe to bar, very quick concentric work, they are more prone to developing this thing called coning, and that's not a good thing. So, it's super important that I think, obviously, throughout the pregnancy period, that someone who knows the sport or whatever exercise regimen you're into, that they are fully aware of what's going on. So for me, I outsource that to particularly Dr. Kristen. I personally know her. So, however, during weightlifting, so getting back to CrossFit classes as a prime example, I've seen and watched from afar, and even worked with some of the females in our gym who I've seen their pregnancy throughout the first, second, and third trimesters, that they literally worked the barbell up until the third trimester. So as the baby in the belly grows forward, something obviously to consider is to lessen your load lifted. I know a particular athlete who can perform barbell clean work at like 175 pounds. But as her belly grew to help form the baby, she had to take the barbell out of the picture because the bump of the baby actually was getting in the way. So then that's where the use of kettlebells and dumbbells come into play, but you can still get the same stimulus of what's prescribed for that class. So, at some point you might just have to put the barbell to a side, right? Because we don't want the barbell actually like bumping into the bump, right? So, that's why kettlebells and dumbbells are just awesome to work with. Another key thing during weightlifting specifically, or anytime you're carrying some heavy load, is try to avoid breath holding. So breath holding, when we do hold our breath, we build up a lot of abdominal pressure, which obviously if someone's pregnant, that's where the baby sits, in the abs, in the pelvic floor, like right where our belly button is, right? So by breath holding, we're definitely putting more strain onto the growing baby. So that's another thing to consider. as well. And then lastly, too, obviously throughout this whole process of the pregnancy period is monitoring pelvic floor pain sensations. And when you're in doubt, when you're performing specific movements, if you feel something funky going on with the pelvic floor, and it just feels off, then cease that movement, defer. And if you're not seeing a pelvic floor physical therapist, you need to go get on their schedule and literally do what they tell you to do. So, from what I see from my viewpoint as a CrossFit coach and physical therapist is the ladies who are members of our class, who some of them are, actually, I don't think we have anybody who is currently pregnant right now. They just had babies like 6 months ago. They were very smart throughout the process. They knew and very in tune with their body. But, those are definitely key points that as in the CrossFit world, we want to be mindful. Avoid breath holding with heavy movements. And even light movements. Monitoring any pelvic floor pain sensations or discomfort. And avoiding the barbell perhaps towards the end of the third trimester, because we don't want that barbell literally bumping into the baby. And probably switching to different abdominal wall exercise movements. Maybe it's side planking, or it's getting on your hands and toes, just like a push-up position, and you're kind of just bringing your knee to your elbow type area. And then obviously the big thing with intensity of approaching workouts, we kind of want to avoid going above that 80% threshold, because there's just not really a lot of good research on that, going above 80% in correlation with strain upon the baby. There's a lot of different variables that happen before, during, and after pregnancy, but if you're a lady out there and you're like, I want to continue to exercise, but I have no idea what to do, you need to research for pelvic floor physical therapists in your area where you live. And if you don't know anybody, I honestly, I might know someone in your area who kind of gravitates towards that population, like yourself, right? And, being pregnant doesn't mean you're injured. That is like the most important thing, is during pregnancy, your goal is to be fit for giving birth to this amazing life, right? Which then in turn makes you feel good to have better outcomes. So exercising throughout the whole pregnancy is acceptable. So if you find yourself in this situation, you need to do some research. Find some pelvic floor physical therapists near you and get on their schedule. And you got to be in it, right? And you got to build strength, strong hips, core, and then also get your mind right. I mean, if this is your first child, like there's significant unknowns that you have no idea what's going to go on, right? So that physical therapist can help literally coach you throughout that process on expectations. So again, I want to shout out to Dr. Kristen Heitbrink. She's locally here to the Charlotte area, South Charlotte area. I'll link her info below. And, she's my go-to girl that I trust. And that's what she does. That's her baby, right? She concentrates on pelvic floor physical therapy. So know that physical therapy rehabilitation, it needs to be non-negotiable throughout the pregnancy process, before, during, and after. So stay fit, be fit, place yourself first, function with purpose, and we will see you guys on the other side. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.